Let's start the panel with Ms. Katherine Smith.
Thank you. And thanks very much to Martin for inviting me here today. So what I'm going to talk about is basically taking us a bit back in time to think about why it was that British American Tobacco has had an interest in the better regulation agenda in Europe and been trying to support that agenda. Next slide, please. So I'm drawing on a range of empirical work here that's been undertaken with a number of colleagues, particularly Anna Gilmore at Bath and Jeff Collin at Edinburgh. So we've published 4 papers on this topic, and 2 of which are open access papers. So I've put the links up there, but I'm happy to share the other papers with them. I'll have to rattle through this quite briefly because of time, so I'll move on. Thanks. So just to say a bit about the data sources for this research that I'm talking about. As you'll probably all know, tobacco companies were taken to court in the US on a number of different occasions, and as a result, they had to release internal documents. So this means the tobacco industry, we basically have an insight into their internal thinking that we don't have for a lot of other companies. So we analysed these documents to look at how tobacco companies are trying to influence policy in the EU. In total, we've drawn on 714 documents, but we analysed many more. And then we've supplemented these by looking at data sources, so public reports from the EU, from think tanks, and doing 16 interviews with key informants. So that's what I'm drawing on. So what is better regulation? So, I mean, it's a chameleonic term, I would say. It means different things to different people, and it's changed, what it means has changed over time. But just to take 3 key things, it tends to be used as a means of, that we're going to simplify and reduce the administrative burden of policy. It's often linked to an idea that we should be using impact assessment and risk assessment, these kinds of tools in decision making, and it's linked to the increasing transparency, improving consultation agenda. There have been various concerns that have been raised about it. So is it just as a shorthand for meaning that we should have less regulation? Why is it the impact assessments produced by the Commission don't tend to pay as much attention to social impacts and environmental impacts as economic ones? And how are commitments to transparency working out in practice? Are they being applied equally? To talk you through specifically why BAT was interested in EU regulatory reform, this was a time, if we go back to 1995, where the tobacco companies were really concerned about legislation around environmental tobacco smoke, passive smoking. And they were also really concerned about the precautionary principle. British American Tobacco had been following what Philip Morris had been doing in the US, and they believed that a particular kind of risk assessment, which would have very specific approaches to measuring risk and to accepting, having a cut-off point for what was acceptable in terms of data. They believed that that kind of risk assessment would prevent the possibility of legislation emerging from the EU around environmental tobacco smoke. So they were really keen to push this agenda. It's clear from the documents, but they were advised by a management consultancy company that the EU at that time wasn't particularly interested in risk assessment in a way that might help them. So they were advised instead to focus on trying to influence the agenda around impact assessment, which was on the EU's agenda. Next slide. So impact assessment, I mean, I won't go into details here. The key point to say about impact assessment is there are lots of different types of impact assessment. What BAT were interested in, unsurprisingly, was a form of business impact assessment that would draw policymakers' attentions to the economic impacts. But meanwhile, within public health and environmental research, researchers have tended to be quite supportive of impact assessment because they're focusing on quite different tools. They're talking about health impact assessment and environmental impact assessment. But business impact assessment is what BAT wanted to promote. Next slide. So what's in these kind of evidence-based tools, impact assessment for tobacco companies? To sum up, it's basically a tool that can be used to promote the costs of legislation to businesses, so to draw policymakers' attention to that. It provides an economic and utilitarian frame for non-material outcomes, such as health. And it may increase also the resource interdependencies between policymakers and external actors. So it may require policymakers to consult with organisations like tobacco companies who are quite unique in that they have been increasingly excluded from the policymaking process. Specifically, BAT thought it could be used to challenge the precautionary principle, to delay and challenge regulation, and to secure business representation in stakeholder consultation. Can you click again, please? Thanks. So this is an extract that's taken from an internal British American Tobacco document. It's from Impact, an organisation that they were working with that's UK-based. And this is just summarising what I just said, how impact assessment can be used to further the interests of businesses. Can you click again? Thanks. And then specifically, BAT believes that impact assessment could be used to prevent legislation from the EU on banning advertising of tobacco things. So that's what they say there. So I've given you a summary of why they were interested, why they wanted to promote this. And then this diagram sums up the approach that they took to doing this. So they worked with a lot of different actors. They were advised from the start that if this was seen to be a tobacco industry initiative, it was likely to fail, given the low credibility of the tobacco industry. So they spent a lot of time recruiting other organisations to work with them on this issue that might share an interest in regulatory reform, and they focused on non-tobacco ones. So you can see that, the text is a bit small, but there's a range of other companies there involved in chemicals, retail, food, pharmaceuticals, and the car industry. And then they worked through some third sector groups. So in the UK, it was the Public Policy Unit, and they set up the Fair Regulation Campaign. In the EU, it was the European Policy Centre, a well-known think tank and well-respected think tank here. And they had a kind of closed group within that called the Risk Assessment Forum. That group has now left the European Policy Centre and set itself up independently as a European Risk Forum and is still active. And they worked with trade organisations. And because of this kind of multi-tiered approach, they were able to target the European Council as well as the European Parliament and the European Commission. Next slide, thanks. So the outcome, and this is again taken from BAT's internal documents, so they believed that they were able to influence the wording of the Treaty of Amsterdam. Obviously, this is BAT's take on it. So they believe, they're saying here, look, the wording has changed, and this was in 1997, and it means that the Commission now has to take into account the costs and that they have to be proportionate to the benefits. So this is mandating that the European Union has to undertake cost-benefit analysis. And they saw that, as that extract says, as a major coup for British American Tobacco, and they wanted to try it elsewhere in other regions. So what happened then? The subsequent status of impact assessment in the EU, the European Commission does have a system of impact assessment, and it's an integrated system which is meant to take into account lots of different impacts, so social, economic and environmental. But when you look at the analysis of the impact assessments that have been produced, it's clear that health impact assessment hasn't been fully incorporated, and they tend to place consistently more emphasis on economic impacts than they do on health impacts. Next slide. I just want to make a point as an aside here. So a key finding from this research really was the role that European Policy Centre played in all of this. So when I was interviewing people at the European Commission and some NGOs, they all saw the better regulation agenda as being very much shaped by the European Policy Centre and them being a key source of ideas. But they didn't see the European Policy Centre as being linked to tobacco interests at all. So this is an example of an extract from an interview with David Byrne, who was Commissioner for Health and Consumer Protection from 1999 to 2004. And he said, "I would be absolutely astonished and would find it very difficult to believe if there was any information available which tended to indicate that the European Policy Centre was advocating on behalf of the tobacco industry. That would be shocking." And yet the documents document that quite extensively and quite clearly. And when I interviewed Stanley Krozik, who's now passed away, who was founding member of the European Policy Centre, he said very specifically that he'd never heard of any of these ideas until he spoke to British American Tobacco, and that was the source of their interest in it. Next slide. So once they'd achieved this policy change as they saw it, they were aware that it was a kind of relatively vague commitment, and they needed to do a lot of work in order to ensure that it was going to be implemented and put into practice in the way that they hoped. So they invested now quite a lot of resources in doing this. They held a conference in the UK. So this was entirely funded by and managed by British American Tobacco, although that wasn't clear from the marketing materials, so the people involved didn't necessarily know. And that was all about trying to shape this agenda. The Fair Regulation Campaign continued. In the European Union, through the EPC, they were involved in a business impact assessment pilot study in the European Commission, and they were involved in shaping minimum standards for consultation to ensure that they would be included. Next slide. So did the campaign succeed? I want to be clear that I'm not trying to say that British American Tobacco were the only organisation that had any interest in promoting or shaping this agenda. Obviously, there were lots of other interests trying to shape it. And I think only time will tell whether British American Tobacco succeeded in terms of what their specific objectives were. And there's some evidence that in relation to the tobacco industry, they probably haven't. But they did successfully push for minimum standards for consultation. A system of impact assessment did become a mandatory for most EU policy decisions, and we know that this system doesn't tend to highlight health impacts to the same extent as economic impacts, and we know that lobbying around risk is ongoing. Next slide. So to sum up, BAT and its allies did specifically influence the EU policy-making process in this area, but I think it's important to reflect that other interests did too. But I think what this research does is really draw our attention to with this knowledge, trying to reflect on, does the better regulation agenda do what policymakers are hoping it will do, or is it skewed to particular interests? It also draws attention to the extent and the ways in which private sector lobbies in the EU, and the important role of third sector organisations and think tanks, such as the European Policy Centre. And in that context, I think it also draws our attention to the fact that private sector interests try to influence policy, not only in terms of specific policy outcomes, but also in terms of trying to shape the broader regulatory environment in which they're operating. Okay, that's it. Thank you.